Exactly 40 minutes past midday in our studio clock. Good afternoon, and thank you for joining me on this edition of the program Your Health Ed on Equinoxe Radio Multimedia. Today, we are going to be talking about an intriguing health-related issue, and that is snoring. Do you know about someone who snores and that noise makes you unable to sleep? Snoring is more complicated than you might think because snoring is perceived as an embarrassing habit. It is not often talked about, but today we are going to be telling you about why you should be worried if you snore a lot. But that will be after this short break. And with me in the studio is Dr. Jeff Timbange Lobe, a sleep specialist right here in the city of Douala, precisely in Bonaprizo. It is a pleasure having you on the program, Doctor.
Yes, thank you very much for having invited me for this program. I've been coming a few times, and every time that I come, it's a real pleasure.
Exactly. So today we are going to be talking about a very, very intriguing health-related issue, and that is snoring. Lots of us, we have had the experience of sleeping with someone who snores a lot, and it kind of makes you unable to sleep. What does it first of all mean to snore, for those who don't have an idea of what it's all about?
I think everybody knows about snoring. It's a very common pathology or reality. I don't think there is somebody who doesn't know what snoring is.
Okay.
Scientifically, snoring is a sort of vibration. It's a noise that a person that is sleeping produces, and it's linked to the vibration of the smooth part of the throat. The smooth part of the throat vibrates when the air is passing, and that vibration causes a noise that you call snoring.
Snoring, okay.
And yes. Now there is some type of snoring that is very, very, very rare that we call catathremia or stridor. But I don't want to talk about this type because
it's not very common.
It's very, very rare. I myself never seen a patient with that.
Okay.
That is the book.
Okay then. So now tell us, what are some of the major causes of snoring?
Well, scientifically, I told you, is the vibration of the smooth part of the throat. Okay. Now, snoring is linked to obesity.
Okay.
It's more common with male subject than women, and obesity, alcoholism, the use of tobacco.
Yeah, tobacco. Yeah.
Tobacco, and things like that. But there are people who are not abusing alcohol. They are not smoking. They are not obese.
Yeah, but they still snore.
They snore.
Exactly.
So these factors are favorable factors or favorable factors. But it doesn't mean that if you don't have them, you cannot snore at all. No, it can still happen. And it is linked to heredity.
Okay.
Some your families of snorers.
It's hereditary, meaning if your mom snores, you have there's a tendency that the child can equally snore.
Absolutely.
Okay, so let's talk about something. I have a friend, I think years back, and she told me whenever she's so tired, she tends to snore. Yes,
there are people who will snore every night, and the other who will not snore every night. They will snore once a week, once a while, and they will tell you, I snore only when I'm very tired. But generally, when a patient tells you, I snore when I'm tired, when you call the partner, they will tell you that it's more than what he thinks. So sometimes, even if he's not tired, he will still snore, but he's not aware of.
Yes,
but what characterizes snoring is that the person snoring doesn't hear the noise.
Exactly. Most are not
aware. And that noise can be acute, high, disturbing, but he will not hear it.
For sure.
But if you make such a noise, he will wake up. But that's not. His snore will never wake him up.
Okay.
No matter the intensity. And this is a really surprising phenomenon.
Okay, now, is there a relationship between snoring and sleep apnea?
Absolutely. But what I want to say right away is that it's not all person that snore that will develop sleep apnea. You can have people who snore quite okay, but they do not develop sleep apnea.
What is it all about? First of all, sleep apnea. What is it all about?
Sleep apnea is having a period of not breathing or not breathing well.
Okay.
It means that the air is no longer passing through the throat to enter the lungs. It's blocked. That's total apnea. Okay. And now we have what we call hypopnea. Hypopnea is that air is passing, but it's diminished by 30%, or more than 30%.
Does it happen only when you're sleeping? This particular pathology?
Yes, it happens when you are sleeping. If it happens when you are sleeping, it becomes a different matter.
Okay.
And it's no longer linked to sleep medicine.
And with such cases, can it cause someone to choke? Especially when you're sleeping and you're unable to breathe. Can it cause someone to choke? Like
choke is what?
Like coughing
yes,
at
absolutely,
night?
Suffocating.
Okay.
As this suffocating, this what we call in French étouffement or suffocation, is part of the pathology. It's part of the clinical signs of sleep apnea.
So now, with the signs you just mentioned, does it mean if I just have the signs, I should automatically say I have sleep apnea, or I should go to the hospital to confirm?
You should go to the hospital because there is a very specific exam that we call video polysomnography. That's the basic examination in sleep medicine that will take you in the will take you in the sleep lab in Bonapriso here, and then you spend the whole night with us in the lab, and then you sleep with that apparatus, and that will register and account all these phenomena.
Okay.
So if you have sleep apnea, we'll know. We'll see it on the screen.
Okay. So now, why do men snore more than women?
Well, I cannot tell you really why, but
it's true, right?
It's true that men would have the tendency to snore more than women. Why? I don't know why, but that's a reality.
It just happens.
It happens just like that. And but there are women who snore a lot. And another reality is that the husband would not accommodate very easily with the snoring of their wife.
The women can accommodate, and is that normal? That's not normal.
The women accommodate more with snoring of their husbands.
Now, does snoring have an effect on the brain?
Absolutely. Snoring, if it goes along with sleep apnea.
Okay.
Only snoring that has something to do with sleep apnea will have an impact on the brain. An impact is that when the people snore and then develop sleep apnea, when you are developing the sleep apnea, the percentage of oxygen in the blood goes down. We call it desaturation. Okay. It goes down, and this permanent and recurrent desaturation, the diminution of the percentage of oxygen in the blood would affect the brain, and first of all, it can bring the person to develop hypertension.
Okay.
So there's a link between sleep apnea and hypertension.
I see.
Okay. There's a link between sleep apnea with stroke.
I see.
What do you call it? Accident vasculaire cerebral. Stroke. Okay. There is a link between sleep apnea and death during sleep.
Death during sleep?
Yeah, death during sleep. You already heard that somebody was sleeping and died. Just died during his sleep. Okay. So there's a link between sleep apnea with high failure of the heart.
Yeah. Heart failure.
Heart failure. Okay.
Yeah.
So all this pathology tends to go together. That's why you shouldn't neglect snoring.
Okay.
It should not be neglected. You should take it into account and come to the lab, some sleep lab, and be evaluated, so that we know whether this snoring is just a
normal or a problem,
or is a problem.
I see.
And it can lead to more determinant consequences.
I see. To participate in the program, our technician will be soon displaying some of the numbers which you can call and equally ask some questions. If you're one of those who snores a lot and you want to know if it's normal, then now is the time for you to call. These are the numbers: 655-511111. I repeat, 655-511111. Or you can call this other number, 652-025050. 652-025050. Those are the numbers which you can call and participate in the program concerning, which is all focusing on snoring. So now back to you, doctor. Now I want to talk about children. Can a child equally snore? Let's say a child of 5 years old.
No.
It's not normal?
Child is not normal. Snoring can be normal to adults, but never normal to a child. A child that snores is sick and it has to be evaluated.
Immediately?
Immediately. It's not good for the child to snore. And the child can also develop sleep apnea. Okay?
I see.
And can also need treatment as much as snoring like an adult. So, but snoring with children is always linked to hypertrophy of the what we call amygdala. I don't know how you call it.
We have a call on the line. Hello?
Yeah.
Good afternoon, sir. Your name, where you're calling from, and your question.
Yeah, I'm Vincent, calling from Susa.
Okay.
My name is Vincent, I'm calling from Susa.
I got you, Mr. Vincent. You can ask your question now.
Okay. I want to ask, my daughter is 14 years old. She's no. She's doing nothing. She always go to school. When she come back, she's no. For me, when I'm tired, I always no. I don't know whether it's this sickness or what, I don't know.
Okay.
My daughter that is 14 years, she's always no. She saw the next level can every year. I don't know what is the meaning of that.
Thank you so much for participating. Okay.
You're welcome.
It's not normal for a daughter of 14 years to snore. It's not that correct. So how long has he been snoring?
I think he's gone.
He's gone.
But she will listening.
Okay. Probably she had been snoring for a few years back.
Yeah, exactly.
So you see, she must have started snoring very early. And so it's not normal. And we see the genetic part of it, because he himself, he snores? He's a snorer.
But he says not like the child. She snores. That means her own sound is kind of louder than what he has. And I don't think he has been snoring since that age.
Yes.
So there should be a problem.
But he himself is snoring. And she said the daughter is snoring very intensively.
Exactly, very intensive.
That is such that you can hear the noise
from the neighbor's place.
The neighbor room and so on. So yes. So that's one of the signs of the severity of the snoring, when the intensity of the noise is elevated, such that you can hear in the corridor and in other rooms.
We have another call on the line. Hello? Okay, we just lost that caller. Yeah? We're talking about the intensity.
The intensity. So obviously that girl need to come to the sleep lab, so that we know we encounter this snoring, and we know exactly if yes or no it is linked to sleep apnea. But what he's describing as symptoms, intensity of the snoring, make me be sure that girl is suffering from sleep apnea.
Okay. So now, if I have a partner who snores a lot, how can I help this partner so he can stop snoring? Let's say husband?
Yes.
Yes.
First of all, don't divorce with the husband because of snoring, and don't go to sleep in another room because I see some women would like to change the
So is that bad?
Well,
you're unable to sleep because he's snoring and it's so intense.
It's so intense.
You need to have a good bed rest so you can go to work firmly the next day. So how?
It's true. It might be a real problem, but since it's a disease, okay?
Yes.
You should bring your partner.
I think we have another call on the line. We're going back. Hello? Oh la la. Hello? We just lost that caller. Try, insist. We are going to answer all your questions as far as snoring is concerned. Yeah.
So, should bring your partner to be aware of the fact that he snores and it's a problem for you. So you think of what you can do. It's a disease.
Yeah.
And so that disease has to be treated. So, and the modern science, modern medicine give us means to help those who snore. So the patient should come to the sleep laboratory and be evaluated so that we know the intensity of the snoring, the gravity, and then we know what to do to help them. But there's a solution. Okay, there's no solution in terms of drug that we can give you and you stop snoring. No, but sometimes the loss, a serious loss of weight can help.
Okay.
Also, sometimes the snoring is linked to the position while sleeping. If you are sleeping on the back, okay, the tendency is to snore more. So we can put a sort of what we call gilet de abat le tennis. When the person puts it and sleeps, it will prevent him from sleeping on the back and
other side.
Push him to sleep on one side or another. And when he sleeps on one side or another, he tends to snore less. That's a small solution. But the biggest solution can be the loss of weight. Sometimes we can even come to surgery of the stomach, what we call chirurgie bariatric surgery, to bring the person to lose a lot of weight. And when it loses a lot of weight, sometimes the snoring goes off, and sometimes it diminishes sensibly in such a way that the family can feel better. The relationship between the partners can be better.
And that's where we end today's edition of the program Your Health aired on Equinoxe Radio Multimedia. I had as guest Dr. Jefte Bangelobe, a sleep specialist in Bonapriso, precisely right here in the city of Douala. For presentation, I am Immaculate Fogwe, and for technical assistance, I received that from Ephraim Yemeli. From Equinoxe Radio and Television, we say bye-bye for now.
Equinoxe Télévision, au-delà de l'image, nous rendons compte.
7 conseils pour se protéger contre le nouveau coronavirus. 1. Lavez-vous régulièrement les mains à l'eau et au savon ou à l'aide d'un gel hydroalcoolique. 2. Vous ressentez l'envie de tousser ou d'éternuer? Faites-le dans un mouchoir ou dans le creux de votre coude